All right, time now here is 7:23. Ladies, when you are so concerned with everyone around you, it can be easy to neglect or ignore what your body is telling you.
Yeah, I'm sure everybody's heard this story in their family. So take a beat and then take some notes. Courtney's with an expert to explain what you should check on in the coming months.
Yeah, and we're just talking about spending a couple of extra minutes, you know, when you're getting ready for work or just thinking about, you know, getting ready to get your family ready for work and school. You want to check and make sure that you are on top of your own screenings and doing what you need to do to make sure that you are okay. So that's why we brought an expert in to talk about different screenings that women should make sure that they are taken care of. It is October Breast Cancer Awareness Month, but there's also lots of other screenings that should be taken care of as well, because as you mentioned, we're the last ones to think about ourselves, but we're the first ones to take care of the family as a whole. So these are some of the things that we want to talk to Dr. Aisha Taylor about this morning from Kaiser. So we're going to start off with breast cancer awareness because obviously it's October, perfect month to do so. But we did a story last week about a woman who was 68 years old, never had a mammogram because she couldn't afford it. She also didn't know how to do a self-breast exam. So that's one of the things we want to start off with, right?
Right, so that's actually a good place to start. So I usually tell my patients to start with a visual inspection of their breast. I usually tell them to do it one time a month, usually a week or so after their menses if they're having menstruation. And you want to just start with the visual inspection. You want to get in front of a mirror. What I usually tell my patients is kind of put their hands down on their hips. You know, sometimes we put our hands on our hips and kind of push down and look for any skin changes. And what they're looking for is anything that looks irregular. Something, I give the analogy of an orange pill or a lemon pill. This is a grapefruit, but you want to look for any skin changes that maybe look puckered or just kind of an irregular surface.
Different texture that wasn't there before.
Wasn't there before. So definitely something new, which is why it's important that you do it like once a month so that you are aware of something changes month to month. And then I usually tell them after they do the visual inspection to either lie down on their bed, they can raise one arm over their head and put it kind of gently behind their head and just use the 3 pads of their finger to do like a superficial and a deeper pressure just to examine the surface and the texture of their breast tissue. Usually what they're looking for is something kind of firm, and I'll let you feel this, kind of like a rock underneath the skin.
And so it's a very small pebble, and that's kind of what you're saying is what you would find normally if there is something.
It can start very small. Sometimes it can actually be very large, but it's very hard, fixed. It definitely feels different than something spongy like a gummy bear, which would be more similar to normal breast tissue. So it would definitely be firmer, more firm. So again, if you see something different, if you feel something different, say something. Of course, if you see any discharge from any areas of the breast or any secretions that aren't normal for your breast tissue, you definitely want to bring it up to your physician.
Good to know. Now let's talk about some of the other screenings as well. Cervical screening.
Right, very important. So cervical cancer screening is something we should do every 3 years. If your testing is normal, we screen you every 3 years. Of course, you want to talk to your doctor if you fall into a different category. If there's any changes or any abnormal findings, then we will have you screen annually. But again, it's under the direction of your physician. You want to talk to them about when screening is appropriate for you and how often. You know,
just a few seconds left. You've got a blood pressure cuff here. Not everybody has one at home, but that is one thing that we definitely need to check. Heart issues are huge.
Right? So blood pressure is something that we don't always pay attention to, but you can easily get your blood pressure checked. It's something we should do kind of regularly. You can always, at Kaiser, we have a walk-in blood pressure station, which is really good. So you can come on in and get your blood pressure checked and check in with your primary care doctor if there's anything abnormal.
And then a couple more, diabetes as well as colorectal. How often should we do those screenings?
So it depends on your age and your family history. So again, a conversation to be had with your doctor. Very easy test to do. Diabetes screening can be done with a simple blood test. And then colorectal screening can be done again in the comfort of your home, typically starting at the age of 45. But again, a conversation that you want to have with your doctor based on your risk factors.
Absolutely. And I just on Instagram about a month ago posted a picture of the thing I got from Kaiser because I'm a Kaiser member. And it actually told me, you're 45, you need to start your colorectal.
Good job.
And I was like, wow, didn't expect to get this in the mail. But
kind of shocking.
I respect the information and I appreciate that that the healthcare providers are on top of it.
And get it done.
And I got it done, and we're all good. All good. Thank you so much, Dr.
You're so
Taylor.
welcome.
All right, so if you want more information, we're going to link all the information as well as opportunities to contact your healthcare providers to our website, gooddaysacramento.com, under show info and today's date. Ladies, go get screened.
Yes.
Back over to you.